Okay, so you barely walking.
Yes.
Oh my God. Oh, have a seat. Have a seat here. Yeah, you want to sit here? Sit here. Oh wow. Oh yeah, yeah. Like I'm going to introduce myself. My name's Dr. White. I'm not going to say the best, right? But I'm pretty good. NFLP come here. Olympic methods come here. So because I do pretty good, right? Should refer another Olympic methods. This Katy dentist, emergency room MD medical doctor. If you need surgery, he's a new surgeon. I see a lot of patients were just a nurse. So tell me, how do you know
It's
Arnold?
my boss.
He's your boss?
Yeah. Yes.
What?
Is my teacher boss.
Teacher boss?
Yeah.
You guys work together?
No, it's for.
He working in one building and he working in another building.
Oh, so he's a boss?
Yes.
Yeah.
Yes.
Oh my God.
8 years for my boss.
Okay. So tell me what happened to you? Your knee pain?
Yeah. Oh.
I give you a. Oh, okay.
No. Okay. Before the cleaning in my house, this is push for the.
Okay. So yeah.
Mm-hmm.
Which part? This part? Which part?
¿Cuál parte?
All this. Oh wow. So you barely walking. You barely walk here.
Aquí más no. Aquí.
Here more.
Here?
Yeah.
So if I pass in, you feel pain?
Mm-hmm.
So you just right now you're so much pain. 1 to 10, 10 is worst pain. What's your level? 4, 5, 5, 6.
¿Qué
What
tanto
level?
te duele de 1 a 10?
Ahorita me duele 10.
10.
10?
Yeah.
Yes, me no puedo sostener el pie.
She do it like this.
No, this is it. Thank you.
Oh, okay.
She put like that. He only like this.
Mm-hmm.
I see. So okay. So if I pass in, you feel pain? Little bit is okay, right? So like the best part is like he's okay. So mainly here.
Mm-hmm.
Yeah, only here, not here.
Oh, okay. So like how can you do like this? No. Little
Puedes
bit.
levantarla.
Oh, okay.
No.
So it's painful. Okay. Let's see if I can help you get better. Okay. Good. Okay. Washroom? Yeah. Go washroom first. Come here. So I'm gonna take full spine sway. This full spine sway. I'm gonna take a leave too. Okay. So first X-ray facing here. Wow. Oh my God. So okay, I'm gonna give you some like chair. You can hold on. Like facing the wall first.
Cada pañal.
This one. Okay. Turn around. Okay. Turn this way. Okay. So stay here. Okay, good. So just relax a little bit, okay? So make sure you relax, okay? So step to the left until you touch the ball, okay? So okay, good, okay. So if you want to hold on here, so okay, you hold. Okay, make sure you relax, okay? Stay here. Okay. Like Maria, turn this way. Okay, facing the light. Okay, good.
Así, con tu cara así.
No, not this here. Okay, step back. Okay, good. Okay, yeah, good. Okay, so make sure it's just relax. Okay, so just relax. So you want to tell your mom this one is AP open mouth, so you need to open mouth.
Abre tu boca.
Okay, good. Okay.
Así manténla.
Okay, you can close your mouth now. Relax.
Ciérrala ya.
Okay. Oh, okay. Good. Stay here. Facing the wall again. This one.
Volteate hacia el otro lado.
I know it's difficult. So okay, Maria, this time hand and elbow like this. Good. Okay. So step to the left until you touch the ball. Okay. Okay. Oh, that's good. Okay. Good. Keep it like this, okay? Oh, you can put down your hand now.
Bakit tumalog yan?
Turn this way. Turn to the right. Okay. Okay. You want the whole one? Okay. Good. Okay. So yes. Can you move back a little bit?
Hace para atrás.
Oh, okay. It's okay. It's okay. Okay. Oh wow. Oh my God, so you're barely walking. Oh my goodness. Wow. Okay, good. So, you want to come here? So, okay, this is your initial x-ray, right? Like next time you come here, I'm do all this like measurement. I'm explaining to you even more detail. So this is your mom x-ray. So mainly upper back, mid back, yeah, your spine is not straight, right? Mainly is tendon ligament. Yeah, tendon ligament. Okay. Let's see. Wow, your neck is tight. Your neck is tight. Like your knee will be okay. So okay, let me know. So can you do like this? It's okay, right? It's okay.
¿Está bien?
Okay. So let's see. Okay. So can I grab it like this? It's okay. So how about like this? It's okay.
¿Te duele?
Un poquito más.
Ya
It's
dígame.
okay. Yeah, mom's too tight.
Le dónde pone el dedo.
Ya da, güey. Gracias de pelo.
Okay. Tell me, how do you feel?
Yes,
Still painful.
yeah.
Still painful.
It's
So is it a little
normal.
bit better?
Little.
Little.
Little. Es aquí.
Oh, nice. Good. Good, nice move. Oh, nice. Okay. So, okay. You want me? Okay, stay here. So, okay, let me. So if I grab it like this, you feel pain? A little bit, it's okay, right? It's okay. So like I just slowly adjust your knee, little bit, okay? So okay, good, okay. It's okay, right? Okay, good. Better, right?
Yeah.
It's better. Okay. Oh, it's good, much better now. Second day.
Second day. Oh, yeah.
Second time is much better. I put on YouTube then. I put on YouTube, okay. So okay, better, right? Before you cannot, yeah. Okay, nice.
Nice.
Okay. Let's pick one. Yesterday you say 10 out of 10. You can't even walk. So now it's better, right? Oh, this good is perfect. Okay, I put on YouTube. Okay. So.